Well, thanks for joining us, Senator.
My pleasure.
Yeah, so I mean, there's a lot going on the Hill today, so maybe we'll just, as I just mentioned, maybe we'll start with where you just came from, the Help Committee with Secretary Kennedy. What was your takeaway from both your questions and just kind of his appearance in general? I mean, you asked him, for example, about, it's been well publicized, Milwaukee wasn't getting help from the CDC on lead poisoning, and you asked him about that.
Absolutely. Let me explain the situation in Milwaukee. We have 6 schools that have lead in the environment in these schools. We've had several students test positive for lead poisoning. They've had to move 1,800 students in these 6 schools to other locations. And there is a branch of the CDC that specializes in child lead poisoning and hazard mitigation. Every person in that branch has been fired. There's no one answering the phone when the Milwaukee Public Schools call. And so I had a chance to ask Secretary Kennedy about that, and I don't think he even knew. And when I asked whether the plan is to eliminate this branch of the CDC, he said no, emphatically. Well, how can you have this continue when all the experts have been fired? So it was really horrifying. I started by a sort of graphic demonstration of the lack of information and transparency in this administration with him. We have a 6-page document that is their skinny budget. And then when they were charged with giving us their operating plan for the balance of fiscal year 25, after we passed the CR, that was one of their responsibilities, 530 programs simply have an asterisk where a dollar figure should be. We are not getting information, and I think that's deeply disturbing in a larger administration that is acting in ways that don't comply with the law and don't respect the Constitution, that Congress makes laws and passes budgets and appropriation bills, and they are to administer and implement them.
Yeah, let me ask about another, Kennedy initiative. There's been a lot of tension on the NIH,
Yes.
Grants not going out, obviously layoffs affecting the NIH and other HHS agencies. You also have an important role in the Appropriations Committee. What can you do to push back? Is there something that Congress can do to make sure that the law as it's passed, they're actually giving out these NIH grants, or how do you view
Well, it's really important that we raise awareness about this, highlight this, and lift the stories of people who are harmed by these actions. We had a funding freeze, then we had the refusal by this administration to convene the panels that make the grant awards. By this time, the administration should have billions of dollars of appropriated money to the research projects, that they are delayed. And what does that mean? It means delays in cures and effective treatments for things like cancer and Alzheimer's and diabetes. Because I'm in the minority party now, held a spotlight hearing, if you will. I can't convene hearings of committees in the minority, but I can certainly bring witnesses to Capitol Hill. And we heard from a range of folks who gave very personal testimony of how the freeze in funding or termination of certain grants is impacting them, including a 10-year-old named Dewey, whose father has ALS. And all Dewey wants is for his father to be able to see him graduate from high school. And his father is beating the odds because of NIH-funded research. And if that comes to a halt, it means lives.
Yeah. Well, to shift to there's so much going on today. On the House side, Energy and Commerce just actually an hour or so ago advanced out their Medicaid overhaul cuts. It needs to pass the full House, obviously, and there's a way to go, but it's going to come to the Senate. What do you think is going to, have you heard anything from your Senate Republican colleagues? It seems like some of them, at least, have some concerns with these Medicaid changes. How do you kind of view that when it gets to the Senate?
Well, I haven't seen any changes they might have made in Energy and Commerce today, but the plan that I saw earlier this week is estimated to result in about just shy of 14 million Americans losing their insurance and their health care coverage. Some of that is through the Medicaid cuts, some of that is through the allowance of the tax credit that helps people afford their Affordable Care Act marketplace insurance coming to an end. And the idea that we would move forward with a bill that results in 14 million Americans losing their health coverage is, in some ways unfathomable. But I want to remind us that in the first Trump administration, we were able to defeat one of the worst provisions, which was the repeal of the Affordable Care Act, because people told their stories. People shared and organized. And I've been hosting Medicaid roundtables around the state of Wisconsin. I think I'm at close to a dozen in different parts of the state. People coming in and talking about what cut would mean to them and their families. We know that there are millions of seniors in nursing homes who wouldn't have a safe roof over their head but for Medicaid. I've heard from a lot of parents with children with disabilities, sometimes adult children with disabilities, who could not keep their children safe without the Medicaid coverage for health care and other wraparound services that are necessary. A third of all children have insurance through Medicaid. And so we, by organizing and elevating those powerful stories, have a fighting chance to defeat the worst of these provisions.
Yeah, you also mentioned the enhanced tax credits in the
Yes.
ACA are not part of this bill.
That's right.
It's a couple Republicans, at least, have expressed some openness, at least, to continuing them. Outside of reconciliation, maybe once that's over, do you think there is a chance for a bipartisan bill to extend those sometime this year before they end?
Well, first, let's say this is the opportunity. There's a lot of tax provisions in the budget reconciliation. This ought to be one of them. The Republicans are being criticized right now for slashing programs that help the most vulnerable in our society in order to find room in their budget for tax breaks for big corporations and the wealthiest. And this would be an opportunity to provide a tax provision, a tax credit that helps those who are middle class and working people be able to afford health care coverage. This is the time to do it. They should not be kicking it down the road. And that, combined with several other tax provisions like the expanding the child tax credit, earned income tax credit, those would be the type of measures that are really helping the working class, the middle class in the United States, that should be our priority.
Mm-hmm. To shift back to Secretary Kennedy for a second, mm-hmm. Obviously, when he was being confirmed, there was a lot of attention in the Help Committee, which you're on, Chairman Cassidy, pressing him on his vaccine views. He's taken some, even today, he was sort of pressed on the measles vaccine and seemed to kind of give different answers at different times, maybe.
It was my member of Congress who was pressing him in the
House,
that's
Mark
right,
Pocanis, Congressman Pocanis.
Is my member of Congress, and I saw that interaction. He would not answer a question about whether today he would vaccinate his own children for measles. And then went on to say words to the effect of, people shouldn't take medical advice from me. He heads a department, that is the biggest public health agency in the world.
Yeah. So, I mean, is it, I don't know, what you expected on vaccine? How have you viewed his vaccine? I mean, there are some steps I guess he could still take that he has not in taking them back. But how do you evaluate what he's done so far?
He has spent a career creating conspiracy theories around this. He referred clients to law firms and got kickbacks for doing that. I mean, this is part of his life's work, if you will. I think it's deeply troubling that the Senate confirmed a vaccine skeptic and conspiracy theorist to be the Secretary of Health and Human Services.
Well, to shift, I mean, we've been talking a lot about sort of Republican initiatives and defense, Democratic defense against those. To shift sort of more proactively, I mean, you're in the minority now, but if Democrats do win back the majority, whenever that is, what do you kind of view as the next big Democratic initiatives? I mean, in the 2020 campaign in the primary, we saw, public option versus Medicare for all. There was this long, drawn-out debate. I mean, do you think we're going to go back to that, or is the message shifting to something more focused on healthcare costs in a more direct way, or how do you kind of view the message?
Yeah, it's all about whose side we're on too. But I want to share my story. Your previous guest talked about his medical career. I want to tell you why I feel so passionately about healthcare reform. I was raised by my grandparents. And when I was 9, I had a very serious childhood illness. And it landed me in the hospital for 3 months. Now, first problem, my grandparents had health insurance through my grandfather's work, but it didn't cover grandchildren. I wasn't a legal dependent. Then, let's fix this, let's try to get her health insurance. I was then a child with a pre-existing health condition. And back then, as we recall, health insurers did not have to provide coverage to someone with a pre-existing condition. There were also annual caps and lifetime caps that didn't provide for people in need, like the coverage that they needed to prevent them from going into bankruptcy. I ran for office to try to help fix this, and I was very proud when I was in the House on the Energy and Commerce Committee to help write the Affordable Care Act and to make sure that they couldn't say no to people with pre-existing health conditions, that they couldn't have annual caps and lifetime caps. And by the way, I wrote the provision that allows young people to stay on their parents' health insurance until they turn 26. I know that many have coverage and access to health care because of the work we did. But that work was not finished. I was a big supporter of the public option, as you said. People cannot afford their care still. The cost of prescription drugs is out of reach for many. And the cost reforms need to be advanced. But I also think we need to look big picture. I would like to see not only Medicare be available to more, maybe at a younger age, et cetera, but I would like to see it cover dental care and vision and hearing. And I know that many of my colleagues very much agree with an initiative like that. So I think reining in costs, looking at access in both urban areas and rural areas, and I represent both in a state like Wisconsin, and thinking broadly about expanding Medicare coverage is the direction to go in.
And branching off of that, I mean, you obviously, from a political side of things, I mean, you represent a big swing state, Wisconsin. When you travel around back home, what's the message on healthcare that really breaks through to people? Or how would you advise other Democrats to talk about healthcare in a way that, gets through to maybe some swing voters?
So I think too often we start with the numbers, and I did that. I fell into that trap. A third of all children, all the seniors, et cetera. Lifting the stories. I brought every member of Congress can bring one guest to the State of the Union address. I brought Renee from Milwaukee, who has stage 4 metastatic breast cancer. Her cancer was diagnosed by a program in Wisconsin we call the Well Woman Program, but it's basically a congressionally authorized program that allows screening for breast and cervical cancer for folks who don't have insurance coverage or low income. And so she was screened, and that's how she found out. But her treatment comes through Medicaid. And she told me, and we did a lot of TV interviews together, so she got a much broader audience. She said, look, if they cut my Medicaid, my husband and I have really horrible choices. We can spend down our entire retirement savings on my cancer treatment, or I can forego it and probably not live as long. And that is a choice no American should have to face. And so we uplift these stories, and people learn, and people are organizing around this right now. I also think about in the Medicaid battle, all the people whose jobs depend on their being Medicaid. The people who work at the nursing homes, where the majority of seniors in those nursing homes have Medicaid paying for that stay. I think of the nonprofits that are in Wisconsin that are providing services to adults with severe disabilities. And there's a whole set of ripple effects. Critical access hospitals could close, nursing homes could close. So telling those stories is the most powerful thing I think we could
Yeah, stories can really break through to people, I guess. Yeah. Well, that's all the time we have. Thanks so much for...
It sped by.
Healthcare is always fun to talk about, so it goes by fast.
Thank you.
Yeah, thank you.